Today, we are very fortunate and very excited to have Andrew Hale over here, who is not only a certified dog behaviourist, but also the chairman of this particular big group of that's in the dog welfare called Into Dogs. He's going to talk to us a little bit more about behaviour in dogs, what has a profession come into, and what changes has he seen over the last few years. So I'm very excited. So without further ado, we're going to go straight into the interview. Welcome, Andrew.
Thank you, Lennon.
In your experience, do you think a dog's behaviour is affected by the dog itself or how it's been brought up, i.e. the environment? Would all dogs exhibit behaviour issues given a blank slate if all the environment was perfect, or despite the best environment from the best owner, well-cleaned owner, there could still be behavioural issues? What are your thoughts on that?
That's a big question, but it's a good one. I think there's a couple of things we have to look at there. First of all dogs will exhibit behaviour all the time, because we do. The second question is the more subjective question of who sees it as being an issue. So that's important that we look at those two definitions there. Genetics plays a role. So, straight outside the box, dogs will be wired to have a certain drive to do certain things, and if we deny them of the chance to follow through with some of those drives, that's more likely to create some of the issues that we might find more problematic. Poor breeding, poor genes, all these kind of things can help to make a dog more likely to be on the sensitive end of the spectrum. And then environment is a big thing, and one of the most important parts of the education for me is getting people who have puppies, for example, to really know how important that first 12 months is. Getting the right information, getting the right support, so they can give their dog the best chance possible. It does come down to this thing about labels though, because all dogs will have their quirks like we do as humans. Every dog is different. I've got 3 dogs, each one of them has their own challenges, and it comes to this thing around narratives. I see them as that. I see them as the fact that they are a bit sensitive socially, or they're a bit sensitive environmentally. We have to decide as an owner how much we can live with that issue, and also how much it's actually affecting our dog. But all dogs, like all humans, are able to find themselves in situations that become uncomfortable or untenable for them. So any dog can have a behavioural issue at any time, because it depends upon how they feel, and if they don't feel great, their behaviour will change as a result.
Okay, Andrew, can you tell us a bit more about your professional history and what are you doing now?
So I've got a human psychology background. I've also worked in other places like hotels and cinemas, of all places. I came to animal behaviour about 10 years ago. I had the privilege of working with large mammals in a zoo setting, sadly, but gorillas mainly, big cats as well. And I've been working with dogs pretty well exclusively for the last 8 years. I get to work with a lot of the great local rescues, so I've done the consultation work for the RSPCA up in Exeter for the last couple of years. I started working a lot more with animals in distress recently. I love education. I get a chance to talk at quite a few events, and it's a real passion of mine, and that's something I want to do more of as I move forwards. And as you mentioned at the beginning, I'm the chair of the Association of Into Dogs. My main job though is running my behavioural practice, which is Train Positive, and I work with a big spectrum of dog behavioural issues, but I would probably say about 80% of my workload is aggression or overreactivity.
Okay, that's very interesting. So how did you transition from the human side of sort of behavioural or care work into animals? Do you find any similarities?
Oh yeah, hugely, yeah, because behaviour is behaviour, really. When we think about the emotional drive to behaviour and its communicative element, and the neurology and physiology of behaviour, we are an animal ourselves. We are a mammal, high-functioning mammal, so it shouldn't become too much of a surprise that a lot of the clinical side of behaviour is very similar, regardless of the species. For me, there are 2 things around the difference in species. One is the species-specific need, and secondly, species-specific way to communicate that need. But other than that, behaviour is behaviour.
And in the zoo, when you're saying that you were sort of working over there, what sort of animals were you working in the zoo?
Gorillas mainly, big cats as well. So I shadowed a gentleman called John Roberts, who's a real pioneer of introducing positive and humane training into zoos, mainly for husbandry purposes. So that's what really got me interested, and part of that transition from human into animal. There's not many gorillas and big cats around, so I thought maybe I could transfer this to a domestic animal, and I've always loved dogs, and that's where my studies into dog behaviour first started. And it became pretty clear to me early on that there was a huge overlap, actually. When we think, for me, the most important word in the psychology of behaviour is the word relief. It's getting relief through our behaviour for the emotional load that we carry. And I see that a lot in the dogs that I work with. You know, they are definitely trying to communicate something to us through their behaviour. And quite often that is an emotional load of some sort. There is a stress element to it.
And what are the main challenges that you face in your current role into dogs?
Well, with my role as a behaviourist or as the chair of Interdogs?
Chair of Interdogs.
Oh, chair of Interdogs. Oh, lots. I think it's quite a challenging industry, and as far as especially at Interdogs, we have a very broad church of professionals. The industry is changing all the time. It's come on so much. There is a huge emphasis now upon modern scientific ways of practicing. At Interdogs, everything we do is based on a very high ethical consideration. So that's where that's the welfare of the animals or professional conduct. I feel a huge pressure because I represent all my membership. As do the committee. It's not just me, it's the committee. So you've got a lot of great professionals who are reliant upon us as an organisation to support the work that they do. We also have a obligation to support our membership, and the job is a very difficult one. So emotional and mental health is a big thing for us at Interdogs. We're the only member organisation that offers free emotional and mental health support, for example, and that's been really important for me.
And what sort of challenges, what main challenges do you feel, do you sort of face as a behaviourist?
I think there's two big ones for me. One is managing expectations. So owners already have an expectation of how their dog should be and how their dog should act. We call it Lassie syndrome, actually, that's the term for it. So we have a view of how our dog should be based upon modern kind of cultural norms. We might see it in the cinema or in TV or whatever. But the reality is every dog is different and they all have their own needs. So when people bring me in to see a behavioural case, they have a notion potentially that I can go along and in an hour we can fix the problem. But it is about managing those expectations. And the second is about changing narratives. As a species, humans are very judgmental of behaviour. We see behaviour as wrong, naughty, vicious. But in fact, behaviour is just communication. The dog is communicating to us, especially with behavioural issues, they're often communicating to us about some type of emotional issue. So I have to help my clients to change those narratives over. So it doesn't help because culturally in the zeitgeist we have the dominance model, Caesar Milan, the dog father, etc., where a lot of these things have been dismissed for quite a while, actually. So your average owner, their access to good education is quite poor, quite often. So I have to deal with all that before I even start with working with the dog. Because for me, the owner is a caregiver. They're the caregiver to the animal. And I want to help them to be as an aware caregiver as possible. So I do have to look at their expectations and I do have to look at their own narratives.
It's almost as though you sound as though your job is more involving training the owner rather than training the dog. How true is that?
Oh, hugely. And this is the thing, if you have a dog with a behavioural issue, obviously there's a huge range of behavioural issues, but especially the ones that are based around fear and anxiety, it is that dog's emotional state that is the issue. The behaviour isn't the problem. How the dog feels in that situation is. And because it can take a while to help a dog to feel better in those situations, the role of the owner is an important one because they are caregiver. I can't be with them all the time. So myself and my colleagues, we have to try and get the owner to be as an aware caregiver as we can because they're the people who are with the dogs all the time. And getting that understanding is very important. If you're what I call functionally training a dog, sit down, come stay, I could take a dog away and do that. And just come back and give a bit of time with the owner and give them the new cues that I've given. And the dog should respond to them. For behavioural issues, however, it is about the everyday support that dog needs as it works through its emotional issues. So yeah, getting the owner to be as knowledgeable as they can about their own dog and their own dog's issues is really important.
So when working with the owner, what would you say, what would be your sort of, what ideal characteristics should the ideal owner have for you to have a higher chance of a successful outcome? What does the owner need to be for you to be able to be useful and,
I think an open mind is a great start. People will have their own views of their dog and their own dog's issues, and that's important for me as a professional to listen to those because they are the expert on their own dog. But being open to a process. So the two things that the owners need to do, if they can accept the dog they have right now and recognise the issues they have and be compassionate about those issues, and secondly recognise that it's a process and the prognosis can be quite good. I think as long as the owners are prepared to work with you, we use the word compliance, which is just about how much the owners are prepared to follow the instructions that we give. The biggest thing for me is trying to build a rapport with the owner and making sure that the owner feels supported. But that also includes that also involves the owner keeping in touch with me and keeping me updated as we work through that process. But the support is very important.
A question that I get from a lot of owners is, they are getting more and more dog behaviourists around. How do I choose? How do dog owners choose which behaviourist is right for them?
It's a real tricky one. One of the big problems is the industry itself. So the industry is unregulated. So anybody can call themselves a behaviourist. Anybody can call themselves a trainer. Using the term certified is a little bit more protected, only from a trading standards point of view. We do have a big, almost a crisis really in the industry of people who are advertising themselves to do behavioural work with minimal experience, minimal qualifications and no certification. And it is a minefield for owners, there's no two ways about it. I think one thing they should be looking for is don't go to the first person you come across. Do your research. Always speak to your vet. It's always a good first move because the vet should be able to link you in with the best people. Speak to people, interview them almost before you end up employing them to look after your dog. Find out what qualifications they do have, how much experience they have, but more importantly, how much experience they have in that particular topic. So I work a lot, as I said at the beginning, with aggression and reactivity. I don't do so much in separation, for example. I will do separation cases, but I do have colleagues who are a lot better at it than I am. So I'll try and refer on to them. Also look out for the kind of things that they offer you. If somebody's offering you a quick fix, if somebody's making guarantees to you, if somebody's talking around just a couple of sessions and the behaviour's gone, I would be very wary of that. Because the true nature of behaviour is that emotional load that I was talking about earlier. And if we just try and address the consequences of the dog's behaviour without addressing the emotional load that's causing it, you might get a temporary fix early on, but invariably the problem will come again later. There are some good organisations that if the person is a member of those organisations, you'll have more security because you have that to fall back on. I can give you a list to go on the website. Obviously, we've got the Association of Interdogs, any member organisation of ICANN, any member organisation of ABTC, both of those are umbrella organisations, and any organisation under either of those two banners would be you're more likely to get the right type of professional.
Okay. Okay, the next one is a bit of a tricky question. So, do you feel dog behavior is a veterinary or a behaviorist issue or an owner issue? Or what do you think is a mix in between, or if there's what are your thoughts on that?
I think it's a really good question, and I think for me it is everybody's issue. Behavior is a symptom of something. It is not a thing to be fixed on its own right. It is the dog's way of communicating to us through their behaviour. Invariably, there is a two involved with the dog's behaviour. They are too excited, too scared, too frustrated, too much in pain. So I think the veterinary, the clinical side and the behavioural side are two ends of the same stick, really. The owners are obviously very important because they're the people who are the day-to-day carers of the animal. When we think about how much physiology and neurology affects our behaviour, so if behaviour is based upon how we feel, which it is often, if we're feeling in pain or discomfort, then that needs to be addressed and it needs to be looked at. And I really welcome the chance to case manage with vets. It's really important for me because we have to make sure that there is nothing internally going on for that dog that is also affecting the outcomes for the behaviour.
Do you find that in your experience as a dog sort of behaviourist, you have to work with vets quite a lot?
Yeah, and more so. I think things have changed a lot in the last few years. There was historically, from a behaviourist point of view, I think there was a reluctance to speak to vets because of the little divide there is between our professions. Having spoken to a lot of vets, I think there was a lot of vets who also were really wary if the behaviourist turned up. But I think that's getting a lot better. Over the last few years myself, I've struck up some really good relationships with local vets. I've run behavioural clinics in local vets. I do a lot of case management with vets. It's not so much about the vet practice, although obviously vet practices do have a culture, but it is about an individual vet. What I love about Amity and what you're doing here is that you're really open to having that holistic work with other professionals and looking at case management. And at the end of the day, we all want best outcomes. The owners want best outcome, the vet wants best outcome, and so do we on the behavioural side. And the more we can case manage and try and find different ways to make that case management easier, the better it is for those best outcomes.
In your years of working in behaviour, do you think there has been a difference in mindset, mentality of the owners, the profession, of both the vet profession and the behaviour profession, and also the dogs themselves? Do you see a different sort of case coming up, or do you see any differences, or what do you think you're doing right now is quite similar to what you're doing 8 years before?
Oh no, it's changed hugely, and there's a couple of paradoxes here a little bit. I think owners are more aware now, and despite some of the cultural and more historical reliance upon, like the dominance model, for example, they are seeking things to be done in a different way. I think vets are recognising that behaviour isn't just some separate thing, it is part of the whole clinical process. Not so long ago, it was quite often said, oh, I don't think this is pain, I think it's behavioural, as though the two things are separate, but in fact, obviously, the two things are very much connected. The paradox is that whilst we're getting this more professional outlook on behaviour, we're also having an explosion of people who aren't qualified and aren't experienced enough to be doing it. So I think there's a huge amount of will for the clients and from the veterinary profession. The thing that we really need to sort out now is the industry, my industry side of things, so that we can give people more confidence about who they do get on board. A lot of clients, when they seek professional help, they're invariably at the end of a process that they've already gone through themselves. They really need help there and then. When you think that the dog might be euthanized, the dog might be given up to rescue, or even in some cases I've worked with, the relationship between the owners is very, very fraught because of the issues around the dogs. There's a lot to play for here. Our connection with our veterinary colleagues is important because we can, as a collective, as a group, try and work towards those best outcomes so that the owners can pay their money in a way that they feel they can get the best support.
In your experience with working with dogs and owners in this behaviour world, how often do you actually have to use drugs or pharmacology? How often is that sort of involved in your experience?
Increasingly so, and I think that is a result of better collaboration with my veterinary colleagues. Psychopharmacology, especially with a lot of dogs, there are three reasons why I might be thinking of doing case management with the vets on this. The first is that we've, on a behavioural side of things, we've trialled lots of different things and we're still not making any progress, especially with dogs that are presenting as very anxious. Secondly, if we can't even get a foothold on those protocols, on those different trials to do things, and the dog still really struggles even to do the basic thing. And thirdly, if I think there's a welfare issue, and for some of these dogs there is, their anxiety, the anxious state, the anxious mind that they are in all the time is really stressful for them. And quite often getting pharmaceutical support along with the behavioural plan can get best outcomes again. Also, when we think increasingly pain trials are things that are being used because more often than not, especially with dogs who have sensitivity issues or overactivity issues, there could well be a physiological element to that. And looking at doing non-invasive ways of seeing if the dog gets any relief by giving some basic pain relief, that's something that's quite often done nowadays as well. And hopefully this is something that's going to be explored even more as we move forwards. The big leap we have to make is for our veterinary colleagues and our behavioural colleagues to try and collaborate more and to find out that middle ground around behaviour and what's needed to give that holistic support.
Right now, from your experience, do you think there's any platforms, or do you think there's increased collaboration between the vet professionals and behaviourist professionals? How would you see, if you had a magic wand, how would you see us moving forward from there to what would you like to see happen?
There are some things that are being looked at on a bigger level, on an industry level around this. I personally don't think that's a start to try and create a culture or an environment where individual relationships can be formed. For me, is about individual relationships. It's not about you as Lennon the vet being told you must work with. It's about you having the confidence to be able to explore and develop relationships with behaviourists, and for behaviourists to do the same with vets. As I say, I work a lot with different practices, and it helps when you have a good culture within a practice. But ultimately, it is about my relationship with vets. So that's the thing that I hold dearest, actually, is the relationships I've made with individual vets. And I think as veterinary professionals, as behaviourists, you're best served to try and find the professionals that you can work best with, because that's ultimately how we'll get best outcomes. It's the same in the human clinical world. It's having a GP that you really trust and having a therapist that you really trust. So I think that's what we need to do. We need more avenues for that to happen. Some of the things that are happening on a bigger industry-wide level, I think might actually stop that process a little bit. And what I would say to my behaviourist colleagues is reach out to the veterinary colleagues and try and find those relationships. And the best way to do that is through case management, because that's how trust works. When I work with a vet and I think, oh yeah, you're really into doing these things and recognising the behavioural element of this issue, and also for my veterinary colleagues when they work with me, think, yeah, I like working with Andrew because we have a good relationship and I can see how he's working with the client. That's how we get best outcomes.
Okay. What would be your top 3 tips for pet owners who are struggling with their dog's behaviour?
The first one is listen to your dog. As a species, as I said earlier, we're very judgmental of behaviour, so we need to drop some of those labels. If your dog has got a behavioural issue, they are desperately trying to communicate something to you. If we see behaviour as problematic, we're likely to treat it as such. If we see it as communication, however, we're more likely to listen to it. And if we see that communication as the dog trying to tell us that they are struggling with something, we're more likely to want to help. And that's what I was talking about earlier, about changing narratives. So the first thing we need to do is think, okay, why is it my dog is barking then? Why is it my dog is trying to bite me in that situation? Why is it my dog does the damage when I leave them at home? Second thing is to try, once you've worked that out, the second thing is to try and give your dog some relief. The temptation is to want to use punitive measures, because especially if you perceive the dog's behaviour as bad or wrong. But think about where you can give that dog some relief. So for example, if your dog is being destructive when you leave them, try and find some better dog care. If your dog is growling when you go near them when they've got a bone, try and give them a bone where they can be left alone so you don't have to go near them and give them the stress. And that's what we call management, and people see it as a cop-out, but actually it's a really valid and important part of the behavioural support process. It's looking at ways to reduce stress. And thirdly, I would really encourage people not to turn to Facebook. So we see it a lot locally, or my dog's got to go, any advice. It's tempting because it's free and there's a lot of people out there who've done things, but you will end up being confused. So the third thing is speak to a reputable professional. All the things we talked about earlier. Do your research, have a chat with somebody. If they're a reputable professional, they will offer you some of their time to at least talk over some of the basics, and it's worth paying the money to get that situation sorted out, because it will cost you more in the long run.
Pause it, please. So, Andrew, thank you very much for that. That was a very, very fascinating insight to what dog behavior is about, and certainly I've learned a lot more in this chat with yourself. Really, if my audience they were interested, how would it be best to find you? Are you online, or what's the best way to find you?
They can find me online, so www.trainpositive.co.uk. They can find me on Facebook just by searching Train Positive. They can get me by going through your vets. I work with virtually all the local vet practices. So I'm quite easy to get hold of.
Excellent. Well, thank you very much for the fascinating insight, and I'm sure we'll be doing further collaborations in future. And so till the next time again.
Thank you, Lennon.
Thank you.